Good morning. My name is Veronica Epa Inkia, and I am a third-year medical student at the Alabama College of Osteopathic Medicine. I would like to acknowledge the NMF Primary Care Leadership Program and Universal Community Health Clinic in Los Angeles, California, for the opportunity to be able to work at their centers and to carry out this research. I would also like to acknowledge the Society of Hospital Medicine for the opportunity to present and my fellow colleagues with whom I worked on the project. Our project was titled Remote Patient Monitoring Advantages and Challenges of Implementation of Telemedicine Systems in a Community Healthcare Setting. The essential point of our project, which was carried out in a series of health care centers that are geared towards low income patients, was with the COVID 19 pandemic, there has been an increase need for remote patient monitoring systems to enable patients to be able to have televisits, detailed televisits from the comfort of their own home. The Universal Community Healthcare Center piloted two programs, iHealth and Title Care, which would enable patients to do diagnostic medical exams and take their vital signs from the comfort of their homes. Our project was to look over the patients who had been enrolled into these systems to see how much of these systems were being used and the reasons, if any, why they may be some challenges in the usage of these remote patient monitoring systems. We performed extensive chart reviews to identify and follow up potential RPM enrollees, and we looked into the frequency of use by these patients. We identified 202 patients who had been enrolled in a 6-month time span. Of those 202 patients enrolled in the program, 86 of those patients had never used the remote monitoring device that had been given to them. 74 patients had used them very infrequently, which is between 1 and 50 times in the 6-month time span. 23 patients had used them between 50 and 100 times, and only 19 patients had used them frequently, which was more than 101 times in that 6-month time span. From the data we gathered, it seemed to show that many patients were not utilizing the RPMs as much as would prove useful for their continuous use or for the enrolled patients. We were able to identify a couple of challenging factors, including limited staff for patient enrollment, the difficulty of use in measurement of vital signs because these patients had to do them on their own at home. And the understanding of device instructions. The majority of patients who are UCHC patients were Hispanic patients and they were Spanish speaking. So having to access those instructions in English proved a bit challenging, and also access to high-speed internet because this demographic, again, being of low income status, had some challenges with finding some internet to be able to properly utilize these devices. Some of the recommendations we provided were to increase trained staff to identify potential candidates, to provide group support so that patients can talk to each other, and so that those who have the upper hand in the use of the programs might be able to help out the others, and to provide incentives for those who are using the programs frequently so that the use might be boosted. If these suggestions are implemented, we believe that the usage of RPMs is going to increase in this clinic, and we believe that it will be very beneficial to the patients, especially those with comorbidities who can't always make it to the hospital. Thank you so much, and please, if you have any questions, do not hesitate to drop it in the comment section, and I will be happy to respond.